Hi class, this is Rachel Casilla presenting the Great American Smokeout Community Plan. Lafayette is located in central southern portion of Louisiana. The Acadiana area is the fourth largest area in Louisiana. Lafayette is known as the Cajun Heartland, and it is the unofficial Cajun capital of the South. It is located only 35 miles north of the Gulf of Mexico and is surrounded by bayous, swamps, and marshes along with forests. This, in combination of the warm climate, makes Lafayette the sportsman paradise of the South. During the windshield survey, Upper Lafayette was surveyed. It appears to be at one time a small, thriving community. In its current state, it is run down with several empty and condemned buildings. Geographically, it consumes approximately 25% of the city limits. During the windshield survey, the area showed signs of a recession with increased unemployment. Without employment opportunities, the constituents will continue to live in poverty and not have access to basic services. The implications that poverty affects ranges from shelter, education, health, food, and quality of life. The public issue of poverty in declining neighborhoods will require a multifactorial solution. During the recent community assessment of Lafayette, it was discovered the second leading cause of death is cancer, with lung cancer being the most prevalent. There is a high incidence of smokers, around 23% in the area, that could be contributing to the mortality rates. Investigating cancer statistics from the National Cancer Institute, Lafayette has higher levels of prostate, breast, lung, and stomach cancers than in the rest of the state of Louisiana. Linking the statistical information to health behaviors as well as social determinants could provide data to cause and effect. The community diagnosis identified was deficient community health, characterized by the incidence of lung cancer and chronic conditions seen in the community health assessment related to increased smoking rates. This community diagnosis relates to the limited resources and poor access to care for primary prevention and support for education on health behaviors. The population is mostly Medicaid, uninsured, or underinsured patients. They are at a high-risk population due to low health literacy and barriers to obtaining access to care. The plan, the Great American Smokeout, will be held on November 21st. All partners will be on site at a local community center and local hospitals to assist in educating the community on the dangers of smoking. Teams will be educating and encouraging smokers to commit and providing support with referrals to smoking cessation programs. Coordination of care for uninsured and underinsured community members will be referred to UHC for access to care and cessation programs. Teams will be stationed at tables with education material and referral orders to complete on site. A local population health department will house all the referrals once completed, track the community members that have established care, and provide further assistance to members if needed. Community partners and resources. Lafayette has an established lung navigator screening program within the community. The program is committing to providing education, referrals to smoking cessation, and screenings for lung cancer in high-risk individuals. The team is well established with knowledge and referral patterns to partners providing smoking cessation programs. The second community partner identified was a local chapter of the American Cancer Society. This project is founded by the American Cancer Society since the 1970s. Evidence shows decreased smoking rates from 46% to 15% in the United States since beginning this program. This team brought necessary educational resources, including table signs, print ads, quick cards, and benefits of smoking materials. Lafayette also has access to 2 comprehensive smoking cessation programs in the hub city. Both UHC and CIS have established programs within their facilities. Both community resources offer comprehensive programs that include intake sessions, access to medical evaluations with med management, along with individual and group sessions. The goals of the project are to increase smoking cessation education, referral to smoking cessation programs, decrease the number of smokers in the Lafayette community, decrease the number of lung cancer incidents in the community, and provide referrals to primary access to care. The Lafayette community is fortunate to have established health systems, community providers, and nonprofit organizations in its area. Utilizing established community resources that have a common interest to implement change in this community was the foundation for a successful project. The purpose of the collaboration for the Great American Smokeout was utilizing each partner's strengths to provide education to current smokers in the community. Evaluation. Immediate evaluation of the community plan will be the number of participants to enroll in a smoking cessation program. Further follow-up will show the number of participants that remain smoke-free at 1 year. Collaborating with population health teams to provide access to health care will be a positive, holistic approach to engaging in health promotion. Data will also be collected to the number of participants that primary care services were provided. Using qualitative data on the impact of the program with quantitative outcomes will provide insight on interventions that could be adjusted for a more successful project. The goal would be to grow the project year over year, reaching more community members. In conclusion, the collaboration between our 4 partners and resources for the community plan appears very promising. The partners are established and offer a great commitment to reducing the number of individuals smoking in the community. Santilli showed us that when projects have community involvement and incorporation, there is a higher chance of a successful outcome. Lafayette has a great foundation of engaged community partners to collaborate and assist in making a difference in health outcomes of the community. Thank you.